me again. We are going to be doing a cardiovascular and peripheral vascular assessment now. This is going to be auscultating the heart sounds as well as checking all of our pulses. Starting off with listening to the heart sounds, we're going to listen with the diaphragm and the bell. So we'll start off with that. Starting with the diaphragm. What? Diaphragm. There we go. Sorry. We're going to be listening to that. We're going to listen to the aortic valve in the right sternal border at the second intercostal space. Moving to the pulmonic on the left sternal border at the second intercostal space. Down to the tricuspid, which will be the left sternal border in the fifth intercostal space. And then the mitral valve, which is also on the left side in the fifth intercostal space as well. You do that with the bell afterwards. We want to listen for S1, S2. Those are normal heart sounds. S1 is the closure of the tricuspid and mitral valves. And then S2 is closure of the aortic and the pulmonary valves. If we hear an S3 or an S4, S3 comes right after S2, and S4 comes right before S1. S3 is a ventricular gallop. And then S4 is an atrial gallop, and that can just indicate heart failure of some sort. From there, we will have the patient turn on their left lateral side. If you will, please turn on your left lateral side. We will then auscultate all areas again, using the diaphragm first and then the bell. No abnormalities are noted, so that is good. So no further assessment is needed at this time. From here, you can go ahead and play fine again. Thank you. We will now assess the pulses. Starting off with the carotids, you want to check those bilaterally, but not at the same time, just because you can occlude the blood flow to the brain, which we do not want to do. You'll just take 2 fingers and assess both sides. You want to make sure that they are equal. You will then take your stethoscope, and while listening with the bell, you want to make sure there is no bruit that you hear. Which none is heard, and that's good. Moving on down, we'll check the radial pulses, which will be graded from here. These you can check bilaterally at the same time. You will check right here, and you'll want to grade those. A +2 is normal, +1 is weak and thready. That can indicate some type of vascular disease. And +3 is bounding. It can be normal, but we typically want it to be a +2. From there, we'll do the brachial pulses, which is a little bit higher up here. And those are good. And then the popliteal are right below, like the inside of the knees here, under the knees. And then the dorsalis pedis is right here on top. And then the posterior tibial is going to be right here on the inside of the ankles. And those are all good, +2 in normal. So that is all. Thank you.